Would you let your teen have plastic surgery? Well, that is a big question, isn't it? It's something that came up with the recent discussion about the gender surgery in kids. And people are saying, well, if there's no gender surgery in kids, why should any kids have plastic surgery? Well, I would agree, maybe. It just depends on what it is. Obviously, no one would be against a kid having a reconstructive surgery for a cleft lip or a cleft palate or a cranial deformation. And then again, I think a lot of people would also agree that a teenager shouldn't have a Brazilian butt lift. But what about the gray areas? What about things like breast reduction? What about the things like a unilateral implant for somebody with amastia on one side but a normal breast? So I've actually done some plastic surgeries on kids that do fall in that gray area. I've done some breast reductions, done gynecomastia for young men. Why? Because these things can be very, very detrimental to their overall mental health, and sometimes there's things that they can't hide. And so I think that although no one would disagree that a purely aesthetic surgery should not be done on a child, I also am worried about things like bands, because when you start to band stuff, the band tends to grow, and there are a lot of gray area surgeries that truly do help people's overall sense of mental health and well-being, and that are totally safe to do, and I would hate to see those not be available as stuff. So it's actually kind of a controversial topic, and the one that I think common sense should prevail.